Pain on the outside of the hip, the lateral portion of the hip, is one of the most common running injuries out there. And in today's video, we're going to go over what can be causing pain on the outside of the hip and what you can do about it. Hi, I'm Dr. Clay Sankey, chiropractor and owner of TruMotion Therapy here in Charlotte, where we specialize in the conservative treatment of musculoskeletal pain and injuries. That's treatment without the use of drugs or surgery. So if you're a runner with pain on the outside of your hip, you may have seen a doctor and have been told certain terms. Maybe some of these look familiar to you, or more likely you've Googled your symptoms and you've seen some of these terms. So we're gonna go through these and go over which one is the most common cause of pain on the outside of the hip. So the first one, greater trochanteric pain syndrome. What does that mean? Your greater trochanter is a bone on the outside of your hip. When you put pain syndrome at the end of it, it just means pain on the outside of your hip. So that doesn't really tell us anything, but it is a diagnosis that's thrown around out there that you may see. Most commonly, we see this term bursitis. So bursitis is just inflammation of a bursa, and you have a bursa on the outside of your hip here. Recent research has found that isolated cases of bursitis is not very common. We're just not seeing it. Even though that diagnosis continues to be thrown out and given to people, those isolated cases, we're just not seeing them. This last term, that is the most common cause of lateral hip pain that we're seeing in our runners and active individuals, gluteal tendinopathy. Gluteals are your muscles on the outside and back of your hip. Tendinopathy is just another way of saying tendinitis. This is the most common cause of lateral hip pain. We can also see this as being a contributing cause to bursitis, but again, we're not seeing those isolated cases of bursitis. So this is the one that we're typically dealing with when we have pain on the outside of the hip. So we have three gluteal muscles. You have your gluteus maximus, that's a big one on the back of your hip, your gluteus medius, and your gluteus minimus. When we're dealing with gluteal tendinopathy, we are more concerned with the gluteus medius. That is this fan-shaped muscle right here that attaches along the iliac crest, or this brim of your hip, and then goes down and has a thick tendon attachment on the greater trochanter. This muscle is responsible for keeping us in line and stable in one plane when we're running and walking. It helps keep your hip over your knee and your knee over your foot. So this illustration here shows when the muscle is working appropriately. It keeps the pelvis nice and level, but when the muscle is not working, when it is weak, it's gonna unlevel the pelvis, putting strain on the outside of the hip and causing injury. So what are the symptoms of gluteal tendinopathy? What can we be looking for? So obviously we're gonna have pain on the outside of the hip. We may have some pain going down into the outside of the thigh as well, but we're not gonna have pain in the front of the hip. We're not gonna have pain in the back of the hip. It's gonna be the outside of the hip and maybe a little down into the thigh. We're gonna have pain with walking, running, and standing on one leg anytime we are using that muscle. And then lastly, we're typically gonna have pain when you're laying on that side, when you're putting compression on the muscle or tendon. What are some of the causes of gluteal tendinopathy? Some of the main causes that we're gonna see are overuse. We're doing too much too soon. So from a running perspective, if you're adding too much volume or adding too much intensity too soon, you're gonna overwork that muscle and tendon, resulting in injury. Some other things that can contribute to it are what we call a crossover gait. So your crossover gait is like when you're running or walking like you're on a tightrope. That's one foot in front of the other, okay? Or even worse is when you're actually crossing over, you're stepping over midline as you're walking or running. What that's gonna do is that's gonna put more strain on the outside of your hip, again, resulting in irritation of those tissues. In line with that is hip muscle weakness, so weakness of those muscles on the outside of your hip. If you're running on those weak muscles, asking them to perform stride after stride after stride, it could eventually start to break down and result in injury. Lastly, menopause. Menopause has been linked to greater incidence of gluteal tendinopathy. So if you are a woman in that stage of life and you're a runner, you may want to keep this in mind that you are at greater risk for gluteal tendinopathy. So you may want to modify your training, make sure you're building up slowly, or make sure you're doing exercises to help strengthen those muscles on the outside of your hip. So what's some daily advice if we do have this injury or we want to make sure we can prevent it appropriately? Number one, we can build our training slowly, gradually build the volume, gradually build the intensity, no big jumps in training. Number two, as you're running or walking, keep daylight in between your legs. Make sure to avoid that crossover gait. One cue that we'll give our runners is pretend like you're running on the double yellow line in the middle of the road, right? Keep one foot to the side of the other foot. Number three, don't sit too long with your legs crossed. Sitting with your leg crossed over the other one is going to put a strain on those tissues and can irritate it. Lastly, make sure we're sleeping with a pillow or two between your knees if you're a side sleeper. If you sleep on your side without that pillow there, you can be putting that strain through the side of your hip. So we are treating this injury a lot. What kind of treatments are we doing? Number one, we're going to be doing adjustments to the lower back, pelvis, hip, foot to make sure we're keeping good motion in those joints so we're not overloading the muscles and tendons in the hip. Second, we're going to be doing dry needling typically. Dry needling is great for kickstarting that recovery process in the muscle and tendon. It does not hurt too bad at all. It actually feels really good and we can get some pretty quick relief afterwards. And number three, we're going to prescribe exercises to help improve the strength and recovery of the muscle and then make sure that we are encouraging good walking and running form. So for what we've been over in this video sounds like you, we are here to help. Please visit us online at TruMotionTherapy.com to learn more or to book an appointment.